it's kind of shocking to watch a little clip like that and see the attitude of that nurse. And obviously this is a fictional, comedy movie, obviously. But, it was maybe 5 years after the Monty Python bit. It was kind of the zeitgeist at the time, sort of the spirit of the times, to be sort of looking at moms as, didn't you go to Lamaze? Breathing will get you through this. And for a lot of women, it does. And for a lot of women, it doesn't. And having pain medication available is, sort of the humane thing to have. And the attitude has definitely changed on that whole issue. Now, sometimes moms are going to have C-sections. That's short for cesarean section. Actually, they say that back in the olden days, one of the Caesars, I don't know if it was Julius or Augustus, but one of them supposedly was delivered via, somebody cutting his mom's abdomen open to free the fetus, and that's how it came to be called a cesarean section. So here are some babies who are in the transverse position and the breech position. Right, so transverse means sideways, breech means butt first. Sometimes it's butt first. Actually, sometimes the feet are the first thing to exit in that breech position. And then over on the right are circumstances that, the baby's head down, but we have other things happening. So in placenta abruptio, the placenta has separated from the uterine wall before the baby has been delivered. And so it is being deprived of oxygen and nutrition now. And so the baby needs to be gotten out right away. With placenta previa, you can see the baby's head there and the opening of the cervix, and the placenta is between the baby's head and the cervix. So the placenta is going to come out first, and then the baby's going to be deprived of oxygen and nutrition, and the baby hasn't gotten out yet. So in those two circumstances on the right, it's an absolute necessity to get the baby out as quickly as you can. With the transverse and the breech positions, a lot of times, the doctor will try and manipulate the fetus through the abdomen of the mom, which I have heard is as fun as that sounds, but sometimes it just doesn't work. And so a C-section is the only solution in those cases. So there are certain circumstances where a C-section is absolutely required, there's not much choice. There's actually a few more, but I thought that this little description was good enough. What I wanted to talk about is the fact that elective C-sections are on the rise. More women are choosing to have a C-section rather than a vaginal birth. Here's a little cartoon. He says, so you're due on the 17th. And then she says, I'm booked that week. Let's go C-section on the 4th. How does 1 p.m. sound? Like she's overscheduled and just wants to have her baby, fit into her schedule. That's obviously this is a cartoon and a joke, but, there is sort of this idea that, C-sections are more convenient, things like that. So what we're seeing is an increase over time. And, when I first started teaching this class, we were a little bit concerned about the fact that there were about 22% of babies born through C-section, and that number was too high, and they were trying to educate people, and it went down for a little bit there, and then it started coming back up again, and now we're actually past the 30% mark in this day and age. And so, women are seeking out elective C-sections more often. It's not that, we're seeing this increase in C-sections because there are more cases of breech babies or the placenta problems or hypertension or other things. The biggest climb, there's always this base rate of women who have medical necessity for it. And then there's this climb that they're attributing to, elective surgery. So this is just yet another thing for moms to sort of poke at each other about, right? So here we have naturallysavvy.com, and it says planned cesareans may increase health risks in children. They're trying to convince moms that they're actually harming their baby if they have a planned C-section. And then they show a picture of a very premature baby. So I'm not exactly sure what we're supposed to infer from this very premature baby and then this idea of a planned C-section. But okay, might be a little biased and a little bit of propaganda. Then we have on the right-hand side why I had an elective C-section for no medical reason. And so she used a pitchfork because, the townsfolk are going to get their pitchforks and chase her out of town. And then she's got the rope there because, of course, we're going to string her up because she had an elective C-section. Okay, both of those have got to be hyperbole, right? Both of these are overstating their cases. Let's talk a little bit about just honestly and, objectively, the risks of C-section in general and why we would probably want to avoid them if we can. First, I'll start off with just a personal, mom's perspective. Moms should be aware that they will experience more pain following a C-section than they would following a vaginal delivery. The surgery goes through their abdominal wall, and then it goes through their uterine muscle, which is quite the big muscle, and all of that has to contract back down, and it creates significant pain for weeks following delivery. Whereas with a typical vaginal birth, the pain will be gone within a few days, usually. So just in the self-interested side, we've got, you'll experience less pain with a vaginal delivery, so electing for C-section might not make sense if you don't want to experience pain. Then there's the risk, these medical risks, right? We've got blood clots. Whenever you have surgery, the healing wound can cause a blood clot to enter your blood system and cause, a pulmonary embolism, which is where you have a clot in your lung, or you could have it in your heart. You could end up with it in your brain and have a stroke. So blood clots are nothing to take lightly. Infection, again, not something to take lightly. Anytime you have surgery, you run the risk of some kind of bacteria getting in there, and then you have an infection. And even if you survive the infection, you may have scar tissue and other things as a result of the infection that now could inhibit fertility in the future, things like that. Adhesions is the name of scar tissue that can develop on the uterus. It could join the uterus to your abdominal wall. It can join the uterus to other organs and cause significant pain. And then, of course, there are the effects of anesthesia. Some women report that after being under general anesthesia, they experience memory loss that can last them months or even years, where they're having difficulty actually focusing after having general anesthesia. The local anesthesia that's involved in C-sections when they're elective is a little less harmful, right? Because they tend to use an epidural. But if you have to have, general anesthesia, then you have those kinds of effects that can really dog you for a while. So just being, objective with the things that can go wrong and stuff like that. Overall, vaginal birth will produce an outcome that is less painful, less prone to these other negative medical side effects. And so that's my little objective information about that. Something that women oftentimes worry about when they're considering a vaginal birth is the possibility of what's called an episiotomy. Episiotomy is when the doctor uses, they're basically like scissors, to cut an opening in the perineum, which is that skin that's between the vagina and the anus, right? It used to be believed that if you let that perineum tear, it would cause way worse tearing and would cause a higher rate of infection. It would cause a jagged scar that would be harder to heal, and that all bad things would come if you happen to actually tear. And so in an effort to prevent tearing, they would do this nice, neat, straight cut using scissors. And they would just always do it. They wouldn't wait to see if it was necessary given the size of this baby's head and the fact that this mom might have had a previous child and might have, stretchier skin now or anything. They didn't really worry about that stuff. They just de facto would perform an episiotomy. And so it used to be just a normal thing to have an episiotomy. What they have found is that the rate of episiotomy has really dropped in the U.S. over the past 25 years. And one of the reasons why it's dropped is because they've realized that first and foremost, you can prevent tearing of the perineum through the use of lubricants and things during childbirth. So they'll use KY jelly, they'll use perineal massage to try and loosen up that skin so that it doesn't tear, it just stretches when the baby's head arrives. And they've also discovered that even when the baby's head does tear the perineum in that situation, that a less straight cut actually heals better. So most doctors are no longer doing episiotomies just as a normal course of childbirth. And absolutely, nurse midwives don't do it as a normal thing anymore. And, the midwife doulas would probably not do it at all. And so only about 30% of moms in the U.S. have episiotomies at this point. And probably it's a little lower now even than it was in this data that I got from 2006. It's probably even a little lower because they're finding that the outcomes are much better. And really that perineal massage has been a really big boon to women being able to avoid episiotomies. So I think a lot of times people are scared to have vaginal births because they're worried about episiotomies. Now, I would like to say another problem with episiotomies is that oftentimes it causes a protracted delay between the birth of the baby and then when the couple can resume sexual activities. When you have a scar on your vaginal opening, it makes you not that interested in having anything enter that vaginal opening again. It makes women nervous. It physically might hurt still, or it feels numb and weird. And so not having an episiotomy would allow the couple to resume sexual activities sooner, probably a couple of weeks sooner than they would otherwise. So, the presence of an episiotomy could be a limiting factor for resuming sexual activities. So episiotomy scars. C-section scars are another thing that can cause a delay in resumption of sexual activities because those C-section scars have to heal on both of those muscle layers that we talked about, and they can cause pain and things. So even though maybe everything else implies that it should be okay for the couple to resume sexual activity, the mom might not want to until her stomach feels better. Lochia is the term that we use to describe the blood and tissue that is emitted from the vagina following childbirth. And it's, generally a reasonably heavy period for about a week. In breastfeeding moms, it'll probably taper off after about a week, but it might go on for a couple of weeks. You definitely don't want to resume sexual activity until the lochia has completely ceased because you would have a very, sort of exposed uterus, and you don't really want to expose it to any outside bacteria or anything like that through sexual activity. So, yeah. Now, in a non-breastfeeding mom, lochia may stay longer. It may be 4 to 6 weeks after childbirth that you might have, maybe not heavy like it was in the first week or so, but, sort of this spotty kind of blood still continuing to be emitted for, up to 4 or 6 weeks after childbirth. And without breastfeeding, it does go on longer. Breastfeeding moms' uteruses return to normal size faster, so the lochia goes away faster. So shorter with breastfeeding. All right. So I kind of have alluded to another postpartum issue, which is breastfeeding. Right now in the U.S., about 80% of moms leave the hospital breastfeeding, but only about 30% of moms are still breastfeeding after 2 months. So obviously something's going on, maybe they had to go back to work. Maybe sometime in that first 2 months, they found it to be untenable. There's a lot of things. So I wanted to talk about the pros and the cons of breastfeeding. And again, a nice honest list. A lot of times all you hear is the positives and people forget to conveniently mention the negatives of breastfeeding. So the benefits. As I mentioned, lochia will last a shorter amount of time in breastfeeding moms because breastfeeding actually causes the secretion of hormones that contract the smooth muscles of the body. So that includes the uterus. It contracts the smooth muscles of the intestines. So breastfeeding moms hardly ever are constipated. It helps with their hearts. It helps with all sorts of smooth muscles. And so there are benefits to all the smooth muscles, but right then in the postpartum period, you can imagine that it's an advantage to get your uterus back to its normal size quicker because we'll reduce the likelihood of excessive bleeding and things like that. All right. Now, it boosts cortisol levels. So bear with me for a second. During pregnancy, the placenta has been secreting a hormone called cortisol into the mom's bloodstream, and that helps her to combat stressful experiences. The act of being pregnant is a stressor on mom, and cortisol helps her body to combat the reactions to the stress. So normally it would be boosting blood pressure, but the cortisol helps to mitigate that. It helps to keep the heart rate normal and helps, psychologically for her to be able to cope with the stressors of like the changes that she's going to experience in her life and all those kinds of things. Okay, so she's been having this cortisol level boosted by her placenta, and then it's shed at birth. And so now suddenly she's deprived of this source of cortisol and needs to go back to producing her own cortisol from her adrenal glands and so on. So it takes about 3 days for the placental cortisol to completely clear mom's bloodstream. And then it takes another few days before her body is going to start kicking up its production of cortisol, because it's suddenly realizing, wait a minute, wherever that free ride was seems to have gone. I need to start making my own. There's a delay. And during that period between the loss of the placenta and the onset of really her body starting to make its own cortisol, moms will enter a period that we call the baby blues. It's so common and so universal that it's not considered a disorder. It's just considered a normal fact of childbirth, that mom's moods will become more irritable. About 3 or 4 days after giving birth, she'll be more prone to cry. Even the simplest things will seem too stressful for her. Things like that. And that's because she doesn't have even the minimal amount of cortisol to help herself cope with this stressful situation, the sleep deprivation and the changes and all the things that are going on. When babies nurse, they help to trigger mom to produce cortisol. The actual compression of the nipple has this cascading effect that actually causes her to create more cortisol. So moms who breastfeed will have a shorter period of baby blues and will be less likely to descend into postpartum depression. So that's a really concrete, really specific benefit that comes from breastfeeding. Now, is it perfect? Absolutely not. There are breastfeeding moms who become depressed, but it helps to alleviate and helps to reduce the likelihood that depression would ensue. It also boosts oxytocin, which is a hormone that we oftentimes call the cuddle hormone, because oxytocin makes us feel lovingly towards whatever's around us. Petting your dog or cat gives you a boost of oxytocin, or if you have a ferret or whatever furry animal you might have. Petting it and it rubbing its head against you and all those things causes you to secrete oxytocin and makes you like that animal, right? You're like, you are so cuddly and so cute, right? That's oxytocin that makes you feel that way. For moms, they get that boost of oxytocin through the act of nursing that makes her bond with her new baby and feel cuddly and protective towards her new baby in ways that, for example, the father doesn't have that benefit. He has to build up his feelings of cuddliness and all those things through interaction. Mom gets this extra boost, and that's a benefit. And then finally, it boosts our serotonin levels. And this is another way that breastfeeding helps to offset the likelihood of depression. Serotonin is a neurotransmitter in our brains that makes us feel calm and content. And so the more we're able to offset any decreases in serotonin through breastfeeding, the more likely we are to avoid postpartum depression. Okay, so those are all really awesome things. And I really tried to focus just on what it does for mom. If you take lifespan development, we can talk about all the great things it does for the baby. But we're in human sexuality, and I really want to encourage moms to know, what does it do for me? So what does it do for you as a deficit? Well, it does lower estrogen levels. Nursing moms' estrogen profiles look very similar to postmenopausal women's estrogen profiles. And so you can have vaginal dryness. You can have lower libido, so you're not interested in having sex. So it can have those deficits, those side effects. Some women experience mastitis, which is where they get an infection in their milk lobes that are producing the milk. And that, requires antibiotics. It's really painful. Women who have had it oftentimes are pretty traumatized from the experience because they have blood coming out of their nipple and things like that. It's rare. And, with good lactation consultants, it really can help women to avoid that problem. But it is possible, and it's something that's a deficit. There are cultural taboos. I mean, even in, 2020 U.S. attitudes, seeing a breastfeeding woman makes some people uncomfortable. Some people will actively encourage women to abandon breastfeeding. This seems like a lot of inconvenience for you, and, you don't have to do it. And those kinds of things. And those kinds of messages can make it harder for moms to stick with breastfeeding. If you feel like other people are judging you for doing it, things like that. It's very time consuming, especially in the first 6 weeks. Babies have to feed on demand. Anytime that they express even the slightest interest in eating, mom needs to nurse because she's trying to get her milk flow to be reliable. And so moms could find themselves spending the better part of every hour of the day with a baby latched onto their nipple. And, it hurts a lot at the first and things like that. So, I mean, I'm not going to sugarcoat the glories of breastfeeding. It's hard. But getting through all that can lead to all these benefits that will have long-lasting benefits for moms. Some things I didn't list there. There's a number of studies that have shown that moms who breastfeed have lower risk of breast cancer. Like there's long-term effects. And for the babies, there are really long-term effects of like a much lower risk of ever becoming obese if they were breastfed. So, I mean, there's just like really, they have lower rates of asthma as, children and young adults. There's just so many benefits that come with it. And yeah, there are some hard parts about it, and I don't want to sugarcoat it, but it's definitely overall the cost-benefit analysis does tip towards, being able to get a baby off to a great start and help to return mom back to her normal body faster. How about returning of fertility? A lot of people think that there's some delay between the birth of a child and then the return of the fertility cycle. For the average mom, she will return to ovulating about 6 weeks or 7 weeks after delivery. So pretty quick. Like a mom who has just had a baby should still see herself as somebody who could get pregnant again. Anytime she has sex, she could get pregnant. One of the things that makes it really tricky to know what whether you're fertile again is that if you're breastfeeding, you may experience what's called lactational amenorrhea. You don't have a period while you're breastfeeding for a lot of moms. And so a lot of moms think, well, if I'm not having a period, then I can't get pregnant. And guess what? Yeah, you can. You just have no sign of it because you're not having a period, but you may be ovulating. And so lactational amenorrhea should not be looked at as, birth control. Lots of women become pregnant while they're breastfeeding. So it's really imperative that unless she wants to have a baby within the next 9 months, a woman who has just given birth needs to use birth control every time. Okay. Let's go ahead and I'm going to let you guys watch this video on postpartum depression, and we'll come back and we'll discuss it in the next segment.